The U.S. has surpassed 550,000 coronavirus deaths. Total infections are now well over 30 million as cases spike across the country. The head of the CDC is once again urging Americans to follow preventative measures for a little while longer. But she says there is still, quote, so much reason for hope, and it lies in the pace of vaccinations. More than 16% of the population is fully vaccinated, and more than 96 million people have received at least one dose. Omar Villafranca reports.
Tonight, doctors warning the next COVID surge is not on the horizon, it's already here. Cases now rising in over half the country, 27 states, including New York, Connecticut, and Louisiana. Nationwide, infections up double digits in the last week compared to the one before. Especially troubling, the rise in pediatric cases. In Michigan, per capita COVID cases among 10 to 19-year-olds rising faster than any other age group, more than doubling in the last month.
We're seeing the increase in transmission in young kids, primarily in the upper Midwest and the Northeast right now. But that's just a matter of time before we see it go throughout the entire United States. Unfortunately, we are going to see a rise in pediatric hospitalizations and serious illness.
Doctors saying the surge can be slowed if Americans don't let their guard down and get vaccinated.
We are almost at the finish line, but we're not there.
Today, the head of the CDC talking with the nation's governors.
And I encouraged all governors to include a mask mandate in their states. And to the extent that states were not having a mask mandate, as we do have in Massachusetts, I would ask citizens to mask regardless of the mandate.
But tonight, Arkansas became the latest state to lift its mask mandate.
It's an appropriate time to lift the statewide mask mandate.
Meanwhile, the U.S. and 13 other countries issuing a joint statement criticizing the World Health Organization's investigation in China about the origins of the coronavirus outbreak, saying the study was significantly delayed and lacked access to complete original data and samples. And as the country continues the race to vaccinate, a number of temporary FEMA sites are set to close next month as the Biden administration works to make retail pharmacies the main distribution point.
At the time we opened this site, the vaccine was still limited. We weren't able to push it out to the local pharmacies, doctors' offices, and so now we're seeing it more available.
This FEMA site in LA County has administered more than 269,000 doses in about a month and a half. And as more vaccine becomes available, a new poll shows that more Americans are willing to get the shot, most notably the black community. About 55% now say they're willing to get vaccinated, up 14% from February. Elaine?
Omar Villafranca, thank you. For more on this, let's bring in Dr. Dara Kass. She's an emergency room doctor and medical contributor for Yahoo News. Doctor, welcome. So infections are on the rise across the country. The head of the CDC says governors are, quote, not helping the cause by easing restrictions. What's the best course of action at this point?
Well, the best course of action is to return to mask mandates statewide, to really encourage citizens to mask up until we get to that herd immunity we're looking for, which won't happen until children are vaccinated. And what Dr. Walensky was saying today is true, is if your governor is not going to ask its citizens of your state to mask up, then we're asking the citizens themselves to do it, to protect their fellow citizens and the children in their state.
Well, health experts predicted weeks ago that the variant first seen in the UK would become the dominant strain in the U.S. sometime in March. Have we gotten to that point, and how much are variants fueling the current spikes in cases?
So we know that certain variants are more contagious than the novel variant that we had originally, but we also know that we're seeing spread amongst the original variant that we had because people are just loosening their restrictions and they're not vaccinated. So it is a race between variants and vaccinations, but it's also that people have stopped wearing masks and distancing even if they are not vaccinated yet. We are surveilling the variants in different states and different areas. We know Florida has the majority of the B117, but we need to make sure that it's not just a regression to say that it's the variant's fault. It's really the fact that a lot of people have chosen to go on vacation and stop wearing masks when we need everybody to do their part.
Well, vaccinations are picking up speed across the country. More than 53 million people are now fully vaccinated. Despite rising infections, is there reason for hope, Doctor?
There is. I spent the entire day-to-day vaccinating. I do it once every week or two on a day off, and it is a remarkable experience.
Oh.
What I would say is after you get vaccinated, it would be awesome for you to go to your community and ask, can I help? You know, can you help direct traffic? Can you help register people? Can you help vaccinate? It is a really wonderful experience, and that's the reason we're getting to somewhere around 3 million vaccinations every single day.
Yeah, I can't imagine, Doctor, the feeling of gratitude from those receiving the vaccine, especially, you know, given everything that we've been through in the past year. What a remarkable thing to do. So a new report, Doctor, from the Kaiser Family Foundation shows that counties with lower community transmission and fewer COVID deaths have higher vaccination rates than high-risk counties. How concerning is that? And what more needs to be done to address this?
Well, I think we need to look at the systemic inequities that resulted in higher transmission rates or higher mortality rates to start. A lot of those barriers to healthcare are the reasons that we saw those inequities. And so what we really need to do is to take those barriers down, to have walk-in clinic appointments, to get to communicators in the communities that are trusted ambassadors, and to make sure that that people are getting information where they are from people that they trust. And when we do take down those barriers, we do see an uptick in vaccination acceptance and a decrease in vaccination hesitancy.
Finally, the World Health Organization released its report on the origins of the coronavirus pandemic. Investigators say more research is needed. What did the report find, and what questions remain unanswered?
So there's more evolving information about the origin of the virus and actually where it started, but most importantly, what was done in the original stages of understanding those first few days and weeks. And so I think what we really need is just to wait a little bit for more information to understand exactly what the probable origin of this was. But remember, none of that will change what we're dealing with right now, which is that we need to increase vaccinations, increase mask wearing, and just stay the course a bit longer to decrease the number of infections and deaths in this country.
Such an important message. Dr. Dara Kass. Doctor, thank you very much.
Thank you.